Great, I think we can get started. Good afternoon or good morning, wherever you happen to be. My name is Kimberly Beer. I'm the Senior Director of Public Policy at the Christopher and Dana Reeve Foundation, and we're so happy you're joining us today for our September Regional Champions webinar update. We welcome back all of our dedicated regional champions and anyone new who's signing in. We're really thrilled to have all of you. Before we get started, I just wanted to acknowledge that we have not gotten together since June, so a lot has happened, and we're really excited to give you some really wonderful updates. I also want to go over a little bit of housekeeping, and I also want to acknowledge some really important things happening in the month of September. The first is, for those who are celebrating, I'd like to acknowledge Happy New Year, Happy Rosh Hashanah for all of our advocates and dedicated regional champions who may be observing. It is also the end of Spinal Cord Injury Awareness Month, so we've been very active throughout the month. Hopefully you've been following all of our social media and all of our activities this month. It's also Hispanic Heritage Month, so I'd like to acknowledge that. And finally, this week we celebrated what would have been Christopher Reeve's 70th birthday. So we are thrilled to acknowledge all these really important dates and milestones in September. We are so grateful for those who have logged in. We will record this webinar. We will send it to you after with a lot of the materials that we'll reference throughout the webinar. And I will also do my best to track the Q&A part of, so if you have any questions, feel free to put them into the Q&A or to the chat box, and we'll be sure to monitor those as we go. We'll also have time at the end to answer any questions you may have. So we have a very packed agenda. Let me just minimize my screen here. Okay, for today's agenda, we'll be giving you a lot of congressional updates. As I mentioned, the last time we met was in June. So we'll go over some midterm election updates, appropriations, some recent legislation the Reeve Foundation has supported. And of course, many of you have been tracking the Inflation Reduction Act, which passed recently and has it's a huge piece of legislation. We'd like to give you an update on what that means for people living with paralysis. And of course, since we're looking at an election and a lame duck session, we want to acknowledge what Congress is expected to do before the end of the year. We'll also provide you some important updates on some of the activities that we've been working on for many, many years, including our activities advocating for Medicare coverage of power seat elevation. I'd like to talk about a new strategy that was recently released around caregiving. My colleague Angel will be talking about airline travel for people with disabilities. And then Gerard will be giving an update on grassroots, on our advocacy updates, our regional champions program, and our action alerts. And of course, the Reeve Foundation has many upcoming events we'd love for you to be aware of and participate in if you're able to. My colleagues here, and many of you have been communicating with Gerard, but I do want to acknowledge that today, I think, is his first official Regional Champions webinar. We're thrilled to have him on board. I know many of you have been already speaking with him. He's willing to talk to anyone interested in our programs, and we're thrilled to have him. And of course, Angel, our public policy manager, who joined us also this summer, and our dedicated colleagues at Waxman Strategies, Celicia and John, will be part of our panel today. So I'm going to go ahead and pass it over to Celicia. Celicia, let's get started.
Thanks so much, Kim, and thank you all again for being here with us this morning or afternoon, depending on where you are. As Kim mentioned, there's a number of congressional updates that we want to share with you all. And I will start us off with one that I think has been bubbling up for many of us over the past several months, which are these midterm elections that will be coming up very soon. As many of you may know, this election cycle is going to be a critical one. It's going to decide who has the majority in each of the chambers, so thinking of both the House and the Senate, as well as a number of governor races that are happening as well. For this midterm cycle, as is the case with all of them, every seat in the House of Representatives will be up for election. So all 435 of those seats are going to be up for election this year. This is always the case since the House of Representatives have a 2-year term, but some of those races seem like they will be quite close. There are, of course, some representatives that have safer positions that they'll likely be able to maintain their positions, but for others, There are significantly more challenging races that they have ahead of them. And so we will be keeping a close eye on that. In addition to the House within the US Senate, there are 35 seats that are on the ballot this year. For each of the sort of midterm elections, it's about 1/3 of the Senate seats that are up for election. So we'll be looking closely at those as well. And although the elections are fast approaching and there's been a number of different sort of guesses and estimations of what will likely be the results. The pending results are still not entirely straightforward. And part of that comes from two major issues that have been top of mind for many voters in the country. One of which is around abortion rights, as we all have seen with the Supreme Court decision in the Dobbs v. Jackson court decision earlier this year. It led to a lot of responses from voters, some of which in support of the decision, many of which also against that decision, and may likely impact how people will vote based on what the representatives that are running stand for. The other major issue that still is a major concern for a lot of Americans is inflation and how that's been impacting their day-to-day lives as we think about the economy, how that has had an impact even on people being able to purchase groceries and their home purchases and things like that. It's another significant issue, and that can likely sway voters either way, depending on how they place their votes. So those major issues are things that have been key or are going to be key as we look to these elections. Right now, polls are showing that it seems like Republicans are likely to take control of the House, while it is possible that Democrats could maintain control of the Senate. Again, this is still very much speculation. Anything can happen in the next few weeks, as we know that people are going to be going fully into campaigning mode. But again, this is something that we're going to be paying close attention to and likely will impact a good portion of the work that we're doing. I'm going to pass it over to John now to talk a little bit about appropriations, as that's another major piece too.
Thanks so much, Celicia, and thanks to everybody for joining today. I think we wanted to lead with at least remarking on the pending election, because I think as it gets into fall in Washington, D.C., especially in numbers that or years that end with even numbers, that's really where the focus of policymakers starts to turn, whether it's getting home so that they can campaign throughout the month of October, or whether it's finishing up legislative business that has been sort of stacking up throughout the 2 years that make up each session of Congress. So we're in the middle of both of those things. The one thing that Congress has to do before the end of the month, which is essentially the end of the week, is figure out a path forward on government funding for fiscal year 23. That federal fiscal year begins October 1st. And so Congress has to weigh in on what the appropriations and funding plan is for the year ahead. As folks who've been on these calls before will probably remember, it is very unusual for Congress, and it's been quite a number of years since Congress has actually finalized the entire appropriations plan for the coming fiscal year before that fiscal year starts. And so what they typically will do, and what we're expecting that they will do this week, is pass what's called a continuing resolution, meaning that essentially they will choose a date. It looks like that date will be middle of December, and they will say government programs continue as normal, continue at your current funding levels until December, and then we'll come back and see if we can pass a more detailed bill that will set funding levels for the entire year. Just as a reminder, this process includes funding for priority items that the foundation often focuses on and advocates focus on, like the National Paralysis Resource Center, also spinal cord injury model systems programs within the Administration for Community Living, things like the National Institutes of Health, and other, really crucial priorities. Because we were generally happy with the funding level last year, a 2-month extension of funding at current levels should not disrupt programmatic activities of the PRC in any way. But there is a difference in the draft legislation between the House and the Senate when it comes to next year's appropriation or spending level for the PRC. And that difference basically boils down to the fact that the Senate legislation, again, a draft piece of legislation, not final, contains a higher funding level by about $1 million in the next year for the PRC than the House bill, which calls for essentially level funding at this year's level, a little bit more than level funding. So that's something we'll be following very closely. Again, Congress is not yet at the place where they're finalizing those numbers for next year's funding levels, but they are in the process this week of really deciding what that continuing resolution will look like, and importantly, what other things will basically hitch a ride on that continuing resolution, which is essentially a must-pass piece of legislation. So Celicia will talk a little bit more about that list of things in a moment. Before we move on to that, though, I wanted to talk, since it has been a few months since this group met, about the Inflation Reduction Act. And this is legislation that we and advocates within the community have been following really closely, really since the beginning of the Biden administration, and even during the transition. This has been, at various points, a really comprehensive, massive, multi-trillion-dollar piece of legislation that encompassed most of the President Biden's domestic policy agenda. What ended up passing was still really historic and really a very large and comprehensive piece of legislation, but not on the scale that earlier debates were really having. And the reason for that is, in order to pass this legislation, you can see him there on the far left, President Biden needed the support, in particular, of Senator Joe Manchin of West Virginia. And in a Senate that's currently divided 50-50 between Republicans and Democrats, and on a piece of legislation that did not have any Republican support, that gave Senator Manchin an enormous amount of influence over the final contents of this legislation, since every vote was needed. So what was in it at the end of the day? The Inflation Reduction Act was signed into law in mid-August. Because it was hot and because a lot of people were out of town, they waited until September for sort of an official White House signing ceremony, but the provisions went into effect and went into law on August 16th. On the healthcare side, it was primarily a package that dealt with a number of health issues, as well as some changes to the tax code, and probably the largest investment in renewable energy and climate change in American history. Our team has focused by and large on the health provisions, and you can see some of those there. Those who've been following this closely will remember that the American Rescue Plan passed at the beginning of the Biden administration, made Affordable Care Act premium tax credits more generous, essentially making it easier to afford ACA plans. This would extend those higher premium tax credits and more generous tax credits for another 3 years. It also puts in place a number of Medicare drug-related provisions, all aimed at lowering the price of prescription drugs for seniors and for the Medicare program itself, including a long-sought goal of Democrats to begin allowing Medicare to negotiate the prices of prescription drugs on behalf of Medicare beneficiaries. There were a number of healthcare issues that had been part of this debate throughout, that we'd been advocating for very directly, that were left out of the final package, largely due to that series of negotiations in order to get some of the wavering senators on board. That includes expanding Medicaid in the states that thus far have not expanded Medicaid. It involves maintaining continuous coverage within Medicaid for children. And I think of particular interest to this group, the final bill did not include the investment that the president had called for in home and community-based services, both for elderly and disabled populations. And so that's a thing that we will continue to monitor and continue to work on and work in coalition with a lot of other groups. I think just because it's not in this legislation does not mean, there's not a future path forward for those bills and for those kinds of provisions. But this, I think, marks a pretty big achievement for the Biden administration and for the current Congress. It was definitely on life support for a little while, and I think has come back in a meaningful way. And so hopefully some of these changes will begin to make a real difference in people's lives. We'll talk in future webinars probably about the timing of implementation. Some of these provisions go into effect right away. Some of them go into effect over the next couple of years. But the law was passed into law in August, and will really set the course, I think, for a lot of these policy areas in the coming years. I wanted to turn it to Angel to talk about a couple of other policy areas and pieces of legislation that the foundation's following and supporting.
Thank you, John. Hi, everyone. I'm excited to talk about some of our recent legislation that REEV is supporting. First up, it's HR 8746, the Access to Inpatient Rehabilitation Therapy Act of 2022. This is known as the 3-hour rule bill, and it returns the judgment to your doctor when it comes to determining the type of therapy required for Medicare patients for inpatient rehabilitation. So as some of you may or may not know, Medicare currently requires 3 hours of skilled therapy to qualify for inpatient rehab. So this bill would permit your doctor to modify the specific type of rehabilitation that requires. So it will, and you can include not just regular like occupational therapy or physical therapy. Now they can take into considerations, if this bill passes, recreational therapy, psychological therapy. So this is something that we definitely are advocating for here at REEV. And there's also an update on HR 3173, Improving Seniors' Timely Access to Care Act. And this just passed the House and has moved on to Senate. It passed on September 14th, and this would streamline and standardize the prior authorization process in Medicare Advantage. And also, as Kim said when she kicked this off, this is Spinal Cord Injury Awareness Month. So Senator Rubio and Senator Baldwin, they co-sponsored a bipartisan resolution designating September as Spinal Cord Injury Awareness Month, which passed the Senate earlier this month. And that is it for our recent updates. So I will turn it back to Celicia to go over what's next in Congress.
Yeah, thanks, Angel. And as you all have heard so far, there is a lot that is happening in Congress and DC broadly. So the list doesn't end there. Of course, as John mentioned earlier, they're in the midst of that appropriations process and sort of negotiating this continuing resolution. We've seen so far that it seems that a initial bill was released overnight or unveiled overnight that they're hoping to have votes on by the end of the week, with the goal of funding the government through December 16th, as John mentioned. But there's still a number of other items on the docket and that to-do list that Congress is hoping to get through. One of which is what's called the FDA user fee agreements. Basically, every 5 years, Congress sort of negotiates the overall sort of budget for the FDA and what is needed to fund a large portion of the FDA. And so far, it seems that they've resolved most of the conflicts there. Initially, there were some disagreements and negotiations about what kind of policies could be included in this, because there are opportunities to include additional policies to this overall agreement. But because there were some of those disagreements, for the most part, it seems like the resolution there is to maintain largely the same structure and funding for the FDA that they've had in the past, and keeping a lot of those same policies. In addition to the FDA user fee side, there's also been more of a push in Congress to codify same-sex marriage. Essentially, that new legislation would affirmatively recognize same-sex marriage at the federal level and sort of prohibit states from denying that validity of same-sex unions within each of those states themselves. This has also sort of come into a few hurdles. One of the major ones is related to religious protections. So we're still sort of looking at monitoring this to see what might happen with sort of codifying same-sex marriage. And the last, it's a little bit more nebulous for folks, but mostly around energy permitting. This is something that came from Senator Joe Manchin as a proposal that was initially supposed to be a part of this continuing resolution plan that was made in Congress. It's really intended to sort of streamline the federal permitting process for energy projects. And some of that includes also sort of a fast track for a pipeline that specifically impacts Joe Manchin's state. So that a big part of it is that there are some personal pieces there that has an impact on him, and why that is something that he wants included. Because it was initially something that was promised to him, as John mentioned earlier, from the Inflation Reduction Act, there are some tensions there over whether or not it will actually make it into a continuing resolution. It still needs the votes to move forward. So it's another part that we are still monitoring as it can impact all of the overall work that's happening and efforts that are happening in Congress. But I will now pass it over to Kim to share some other important updates.
Thank you so much, Licia. I think, oh yes, wonderful. Let me just minimize my screen here. So I wanted to provide an update just so many of you are aware, and if whether you're new or you've been with the foundation and our advocacy efforts for a while, we generally have been advocating for increased access to complex rehab technology, which, as you know, wheelchair user knows, that encompasses a lot of different aspects to one's wheelchair that is often customized. One of the major advocacy initiatives that the foundation has been a part of for at least the last 3 or 4 years within a huge coalition of organizations is around having Medicare cover seat elevation and standing feature systems, which, if you've been following this through our blogs, through our webinars, through some online activity that I'll go over in a minute, you'll know personally how important these critical components are to one's wheelchair. And we've been working a long time on this to get Medicare to really take a look at it. We've made a lot of progress in the last month or so. I want to provide some of those updates. In August, and hopefully many of you have attended the NCD roundtable, and NCD is the National Council on Disability, and they hosted a roundtable addressing the issue of seat elevation and standing feature. It was a 2-hour event. It had clinicians, advocates, our coalition leaders really making a strong case to CMS to cover these two things. This roundtable will be published. The recording will be published hopefully soon. As soon as we have the recording, if you're unable to attend, we'll be sure to make it available to everyone. And part of the advocacy that we've been doing is really encouraging Medicare to open up the national coverage determination, which really means to allow the public to weigh in on why it would be important for Medicare to cover these two items. So we have been waiting and waiting and waiting, and finally CMS opened this up on August 16th. We unfortunately were not aware that they would separate the two things. So the public comment period opened up just comments on seat elevation. And we'll be waiting for them to open up standing feature soon after. But this was a wonderful opportunity. We publicized it, we educated our community. And I want to thank every single person who submitted a comment, including many of our regional champions. I want to especially acknowledge Dan Koch, who was very helpful in advising the foundation and giving us some advice on how we could best construct our own comments, but he also submitted some wonderful comments on his own too. And I really just want to acknowledge every advocate and clinician and anyone interested. They received over 3,500 comments, which is a huge outpouring of support. CMS normally does not get this kind of feedback from the community. That comment period closed on September 14th. And September 14th, we also participated in a Congressional Hill Day with some of our coalition partners around this issue. We met with members of Congress, educating them about the importance of complex rehab technology, giving them updates on our activities around CMS. And we also had an in-person Congressional Hill briefing that was very successful, and advocates made their case for the reasons why these components of the wheelchair are non-accessories. They're critical. That was on September 14th. It was a very busy day. We now are waiting for CMS to analyze all those comments, but the Congress really is also weighing in on this topic too. They are circulating 2 letters, and I think many of you received, hopefully if you're on our listserv, a action alert that Gerard will go over a little bit later on, and we hope that you'll take action. We're seeing some great activity already just this morning when we sent it out. We're asking members, Congress is circulating a letter to have their colleagues sign on to a support letter directly to CMS, both in the House and the Senate, asking CMS to not only cover these items, but to also open up a comment period for standing feature. So the House letter sign-ons close on October 3rd, and the Senate closes September 30th. So if you have not received that action alert, please reach out to Gerard. We'll make sure you get it. And I just want to thank everybody for their activity, for their support, their consistency around this. You may wonder, why do we focus so much on Medicare? Medicare usually sets the stage for other insurance policies and the way payers reimburse items like these. So it's really important in advocacy efforts usually to start at Medicare. So I want to thank all of our coalition partners, all of our advocates. We're not going to stop, and we'll continue to keep you updated. So thank you for your advocacy around that issue. John mentioned that in the IRA and the Inflation Reduction Act, that home and community-based services was not included. And, you know, the advocacy community was very disappointed, and so was the Reeve Foundation. But we are not letting up on how important it is to continue to talk about this topic. And last week, and hopefully you were able to watch live or receive the recording, we worked with the Washington Post on talking about the caregiving crisis, and our own Regina Bly, our Chief Program and Policy Officer, talked about her own personal story as a wheelchair user, but also how the Resource Center is providing assistance for caregivers, for family caregivers, and how the foundation will continue its advocacy efforts on not only getting increased funding, but really raising awareness and trying to work to find solutions around so many aspects of this complicated issue. On September 21st, the Administration for Community Living, and as a reminder, that's also where the Resource Center lies within that agency too as a grantee, released a roadmap for improved services and supports for family caregivers. And you may not remember from some of our past webinars that we have been working and tracking the activities of the RAISE Act Family Caregiver Advisory Council, as well as that of the Advisory Council to Support Grandparents Raising Grandchildren. These 2 councils were established as part of a law that passed in 2018, and they were tasked, they had a huge charge to really, they met over the course of 3 years and provided recommendations to Congress on how to best improve not only cross-agency activities around caregiving, to actually provide and name really important aspects where the federal government agencies at the state agencies at the federal level, at the state government, organizational level can make changes to improve caregiving. So a national strategy was released based on the recommendations of both of those councils this past week. And ACL seeking individual feedback, similar to the way CMS opened up their national coverage determination, asking for the public comment to weigh in. This is another opportunity for individuals to weigh in. And we'll be sure that you receive the actual strategy, but also a summary. It's quite a long document, but it's really, really important that we hear from the community, and that will open up on October 1st. So we hope that you keep your eyes and ears open, and we'll be sure to flag that for everyone so that they can also weigh in. And the foundation will also be providing their own comments. But just as a quick overview, the strategy proposes 5 main goals: increasing awareness and outreach, building partnerships and engagement with family caregivers, strengthening services and supports, ensuring financial and workplace security, and expanding data research and evidence-based practices. And as a reminder, I just wanted to highlight that there are 53 million family caregivers and more than 2.7 million grandparent and kinship caregivers. So they're a huge part of how they provide support and care for their loved ones, especially those living with disabilities. Next slide, please. And I would be remiss if I didn't really say thank you to one of our extraordinary regional champions and peer mentors, and just a wonderful overall advocate in person from the Reeve Foundation, James Murtha, who participated as the only wheelchair user on this council for 3 years during COVID, and really playing a really important role in reminding the council, and then reflected in the actual recommendations, that the direct care for workforce is exceptionally important, and the need for financial incentives and support for these caregivers is essential. So I wanted to say thank you. I think James is on this webinar today, and hopefully down the line we have to do a better job of engaging in real time with our advocates on these webinars. So we'll be sure to have some kind of roundtable talk about James's experience. So I want to say thank you, James. And please, for those on the line and in the recording, please weigh in on October 1st. And now I'll pass it over to my colleague Angel to talk about airline travel.
Thank you, Kim. Yeah, I'm really excited to just share some quick updates on what's happening with accessible airline travel. I'll talk about there's a new Bill of Rights that the Department of Transportation just issued, and then give you some updates on our Air Carrier Access Amendments Act, and some other updates. So if you want to go to the next slide. So this past July, the Department of Transportation released an Air Passengers with Disabilities Bill of Rights. They released it right around the time of the anniversary of the ADA anniversary in July, and Secretary Pete Buttigieg gave a message around this, and they really are supporting our fight, our advocacy for air travel, accessible air travel. And so you can see here it includes the right to be treated with dignity and respect, right for assistance at airports, the right to travel with an assisted device or service animal, and some others. So please take note of these, and you can it's really easy to find on the Department of Transportation's website. And I think we should remember this when you're traveling. And if you have any issues when you are traveling, the DOT does have a hotline that you can call. It's a Monday through Friday, 9 to 5 hotline, but there's also an online link where you can submit any grievances that may happen that come up if you find that your rights are being violated while you're traveling. And we know that this happens very often, and you may feel like I've reported, I've gone online with DOT or the airline agency, but it's just, we just still want to stress that you still report any issues that come up while you're traveling, because the Department of Transportation wants all of these complaints. They want to review and report. Review and report is required by law, and then they can take all of these complaints to Congress. So thank you for continuing to help us advocate on your behalf for airline travel. Next update is just an update on the Air Carrier Access Amendments Act that we've been working on with our coalition. There's currently 54 co-sponsors in the House and 10 co-sponsors in the Senate for the bill reauthorization, which is very exciting. This is the most co-sponsors that the bill has had in Congress since it was signed into law back in the 80s by Reagan. So All of us in the coalition are very excited about the progress that is being made. This bill would expand the provisions prohibiting discrimination against disabled air travelers, among other things. And also it would authorize an individual and the DOJ and give them the ability to pursue civil action for discrimination. So we are working very hard here at Reeve on this reauthorization. Also, I just wanted to share briefly, and when we send up a follow-up email after the webinar, we will include results to the Paralyzed Veterans of America survey regarding the air travel experience of passengers with disabilities. I imagine many of you on this call participate in the survey, so we thank you for this. I mean, it provided so much valuable data that will inform us as we continue to do this work. So we will send the survey results around so you can see what others have to say about their travel experience. And I also, if you can go back real quick to the previous slide, there was a recent New York Times article that profiled Paralyzed Veterans of America's president, Charles Brown, and his flight experience. This is a wonderful article that does a step-by-step from check-in to being transferred from his power wheelchair to the aisle seat to his chair. And we highly recommend all of you to read this wonderful expose on air travel. It's a great article there. So we can include that in our follow-up email. Last week, I was in Seattle for a working group meeting at the Museum of Flight, and this meeting focused solely on in-cabin wheelchair securements. And we met with various stakeholders from interior designers, engineers, the head of the flight attendants associations, and a few airline representatives to talk about the possible and allowing you to keep your power chair on the plane. So we have a video here that we wanted to share with you today of a prototype of how this would look. And it's very, very exciting. So as you can see there, you would back in and clip in, similar to how it would work on in a vehicle, a train, or a bus. And this would be a rearcraft entry where you would pull in. So we're excited about this, and we can send more on All Wheels Up and what they're doing as well in the follow-up. So thank you. Now I will turn things over to Gerard for our grassroots update.
Thank you so much, Angel. Thank you again, everyone, for joining us. I am excited. This is my first webinar, so I'm so happy everyone could join. But let's get started for grassroots. First off, we have our Reeve 2022 voting guide. As you all may know, about 2 weeks ago, September 12th through 16th was Disability Voting Rights Week. Our voting guide, Angel worked very hard on going through each individual state, combing through, getting all the specific laws and rules and regulations, but it provides voter information for each state and the District of Columbia. I included the link in the slide. I will also send that out as well on our follow-up email, just so that everyone has it and it's fresh in the inbox. But I do want to mention, like, as the midterms are approaching, I know Celicia mentioned it earlier, be sure to check with your local board of elections, as details around voting can change, anytime states update their capabilities. But our voting guide includes deadlines for voter registration, absentee ballot application deadlines, as well as just individual facts for each state, and just to help the community know what options are available to them. If we can go to the next slide, please. Oh, thank you. So as for our advocates updates, as of yesterday, we had 9,714 advocates. Our goal by the end of the year is to reach 10,000. And I can report today that since our action alert went out that Kim mentioned earlier, we now have 9,774. So we are increasing, and Kim said our action alert was doing very well. I will talk about that soon, but just help spread the word. It takes five minutes or less to sign up. So definitely it would be really great to reach that goal by December, or end of December. Just with the map a little bit, that's what we call a heat map. Just the darker shades colors are more advocates in each state, and the lighter ones are less advocates. So as you can see based on the map, we definitely want to try to have our reach go into the Midwest. So if anyone knows anyone, if whoever's watching, or if you're watching the recording, definitely reach out to someone. It would be great to just have them on board. We go to the next slide, please. Thank you. All right, so Regional Champions Program. As you know, I am in charge of the program, and thank you all for all of our regional champions who have reached out to me. We've connected, we've spoken over Zoom. It's great to know each and every one of you. But so far right now, we have 54 regional champions in our program. We're in approximately 24 states. And, you know, it's really great our goal is to get 435 regional champions in each congressional district. So we have full range of Congress. We can just at any moment's notice, we can schedule a call or a meeting with your local legislators just to get the issues to their desk and to just kind of tell them your story. If we haven't connected yet though, and you are watching, please reach out to me, because I totally want to meet everyone and just kind of tell them what we're up to. And you know, it's just great to see new faces, and I love talking to people. I can talk about anything. But yeah, also one other thing I wanted to mention is I'm currently updating our regional champions data. So, you know, if anyone who's a current regional champion, or you know someone, please reach out to me with their name. I definitely want to kind of update your information and just kind of let you know where we're at. But yeah, and in regards to joining the program, if anyone who's watching, or you're watching yourself and you know you demonstrate engagement on issues impacting the community, you have existing relationships with elected officials, we totally want to get you on board at this program, because it would be great just to kind of continue that relationship, and you'll also be impacting the disability community as well. So thank you for that. If we can go to the next slide, I'm going to update you on the current action alert that is live now. As Kim explained earlier, we do have an action alert that's out. She explained the deadlines. The Senate deadline is September 30th. The House deadline is October 3rd. Basically, our ask is to just contact your House member or senator, obviously, and ask them to sign on to the letters to CMS Administrator Brooks LaSure. The email went out about 10 a.m. this morning, so definitely check your inbox. I will also include the action alert in our follow-up email, just so that you have it fresh as well. When you complete the action alert, you can edit the email. So if you want to kind of customize it to make it unique to your own, definitely do that. We want legislators to hear your story, especially you're their constituents. They want to hear from you. And that would just be great to have. So definitely spread the word about our action alert, and our goal would hopefully to have CMS advanced Medicare coverage for power seat elevation systems, but also have them open up power standing systems, public comment period as well. One more thing I wanted to say before we skip ahead. If you are watching and you don't have access to a computer, you can also text Advocate CRT to 52886, and it will just bring you right up to on your phone. It will text you, bring it right up, bring you the link, and you can just sign up there, take action there. So want to make it very easy for anyone. Okay, we can go to the next slide now. Thank you. So we have a lot of events, as Kim said in the beginning, a lot of upcoming events, but I just wanted to highlight a couple of them. Here we have on October 9th, we have the Team Reeve Chicago Marathon. So if you want to check that out, if you're in the Chicago area and want to, you know, go down and just see everyone's running, definitely. October 12th, 2022 is Stem Cell Awareness Day. There's a Stem Cell Awareness Day webinar presented by CIRM. I will send out that registration invite in our follow-up email. And then we've been planning for a very long time our third annual Reeve Summit in Washington, D.C. It's October 13th and 14th. If you do want to, if you are in DC and you want to come come down and show your support, definitely sign up for our summit. It would be really nice to see do faces and just kind of get you all the information. And then finally, on our last event that I highlighted is the Team Reeve New York City Marathon, which is on November 6th. And I believe that is a Sunday. Like I said, our action alerts, we have the congressional letters to CMS Administrator Brooke Chasseur, which is live right now. And then Kim mentioned earlier about the 2022 National Strategy to Support Family Caregivers. I will be working on a call to action to let our advocates know, and anyone who's watching, definitely to comment to ACL. But yeah, that's pretty much the grassroots update. If anyone has any questions or comments, definitely let us know in the comment box. But yeah, thank you.
Thank you so much, Gerard. And if you are able to, Gerard, would you mind putting the texting information in the chat?
Yes,
If
yes.
you can, just in
Mhm.
case someone didn't catch that. It's a great way to also
Perfect.
take advantage of the action alert. I just want to make sure that we give time to anyone to ask any questions. I'm just monitoring the Q&A chat. I want to thank everybody for joining us. I really want to thank my colleagues for their wonderful updates. I don't see any questions. Please reach out to us. And I want to thank everyone again. I'm just double checking. Okay. Looks like there's no questions. So thank you for joining us this month. We'll be in touch probably after the election, but of course, feel free to always reach out to any one of us, including Gerard. Thank you again for your time and your dedication and for your support of our advocacy priorities. Have a great day.